Through careful manipulation and good storytelling, you can get everybody to clap at the same time, hopefully laugh at the same time, and be afraid at the same time. So some similarities to that in terms of the messaging we do with our patients. So communication skills are obviously a critical component to what we do. How we frame things affects our patients. We can get them excited for the process they're going to undergo. We can ease their concerns, but we can also scare them as well with some of the risks and benefits. So for complex cases, I have 3 goals. Number 1, I want to set clear expectations of the course of care, pre-op, surgery, post-op. I want to make them aware of the risks and benefits that they're going to go through in this procedure, but I try to put them in a confident place and a positive mindset to focus on the positive. So case example, massive cuff tear, possibly irreparable, 58-year-old guy, good forward elevation, subscaps intact. So for me, this is a partial repair candidate. So the story I want to tell this patient, I want to let them know that this is a more complex case than their neighbor's rotator cuff or their friend's rotator cuff, not the standard cuff repair. I want them to understand my patient outcomes and experiences. This is a great chance if you have data to present that to the patient. One of the reasons I collect my patient-reported outcomes is not just for publication. It's also to be able to discuss my patients what my results are. So in this case, I've published on partial repair. I can quote him my 1-year and 5-year success rate with this and give them that information. I want them to understand the risks and the benefits of surgery. I don't want to scare them too much. So if it's an arthroscopic procedure, I'll tell this patient, I don't think you're burning a bridge with this approach. And I want to try to focus on the positive and put them in a positive mindset. So the most difficult communications I have are not with complex cases, it's the surgical failures and the complications. That's the ones where these are the most highly leveraged conversations we're going to have. You have the patients coming in various mental states. Some of them are scared, some of them are angry, some of them are confused. So in these cases of surgical failures or complications, I think clear communication is paramount here. So I think there's 3 types of complications and failures you're going to see come through the door to see in the office. Number 1, a complication where we cannot define who caused it, a complication where another surgeon may have caused it and it comes to your office, and then lastly, a complication you caused, the worst type.